I work for a virtual program with Preferred Family Healthcare, and it provides services in a 3D environment, and it gives them the flexibility of having convenience. It addresses transportation difficulties from mainstream outpatient treatment, and it gives them the opportunity to access resources for their recovery process anytime that they choose.
It's online virtual world counseling, so you can do individual sessions as well as group sessions at your accessibility. So anytime that you're available to do sessions, it's kind of at your fingertips.
Our premise has not ever been that virtual treatment would be better than traditional treatment. It has always been to be able to provide treatment to those people that have barriers to getting traditional treatment.
There's many clients that are unable to access traditional treatment, especially if they live in rural areas. Maybe they live 40 or 60 miles away from the nearest treatment facility. Maybe they've lost their license because of a DWI charge, or maybe they don't have a vehicle or can't afford a vehicle, can't afford gas money. So we have found a way, using the virtual world, to access those clients, using computer technology to enter into a virtual world from their home through computer, through the internet. As from our office, we're entering that same virtual environment through our computers, through the internet, and then we can meet in that virtual space.
This kind of gave people an opportunity to access treatments based on their needs. And so they could come, and if they needed to do a session every day, then they could do a session every day instead of just one time a week for a couple hours a week.
It's really cool because I get to wake up in the morning, I get to get my cup of coffee in my own house, and I get to go sit at my computer, and I get to talk about my rehabilitation with a real person over Lines. And it's really easy because it works on my schedule.
It allows me to have treatment, when I can't get around or, I'm busy. It allows me to access a counselor, and it's as easy as logging on, choosing an avatar, and going.
People are more open, they admit quicker when they've used, which is something that's very hard to do when you're sitting face to face with another human being, your counselor. Just kind of the magic of that environment and invites them to be more open and honest and not be afraid when they're sitting in front of somebody else.
I think the group components for the virtual world are very unique in the setting that we can create whatever environment that we prefer.
Instead of going into a group session where I'm sitting on chairs and I'm talking to people, I get to go online and go across the world. I get to be in this big meadow field where there's overlooking an ocean.
As time goes on and as clients continue to engage in this world, it becomes more and more realistic. So the more somebody is immersed in this environment, the more the technology starts to kind of disappear.
The results of our virtual programming or our portal programs has been, by and large, as good or better than traditional treatment when we compare the two. In the virtual programs, we have been able to maintain people in treatment longer. We have been able to assist them to increase their recovery activities so that they're engaging more in recovery activities.
I hope the future brings, for me in my recovery, that I stay sober, I can live my life like a normal person without having the crutch or the extra weight, I guess, to carry around. The virtual world is excellent for that because anytime I need support or things of that nature, I just hop on, talk to my counselor, and it helps with whatever problem I may have.
I think that young people in my age group really enjoy the virtual world program. It's kind of like a game, actually. I really enjoyed it. It was exciting for me when I started because I changed my avatar every single day just because it was something to do. I think it's just taking the next step into technology and treatment and integrating that into an effective way for young kids to approach treatment.
This is a technology-based generation, and therefore they're encountering technology on a daily basis, whether it be social media, courses online, schoolwork, projects. So this addresses their treatment environment in a context that they are very familiar with.